Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on this program.
Yes, sir. Let's get into the COVID-19 vaccine. A lot of people are concerned that some of the bigger countries are seemingly buying out the vaccine, and they're concerned about the smaller countries having access. In the case of Ghana, could you tell us whether this would affect us in any way or so?
Well, I think this was recognized some time ago, and that was why COVAX was created. Because COVAX, the intention here is to group countries together. You have 190-something countries now under that COVAX mechanism. And because it's so many countries, they're leveraging the buying power of all of these countries to be able to access vaccines at a cheaper price and also to be able to negotiate with the manufacturers. So through COVAX, that's how Ghana is going to get its vaccine. The more developed countries, of course, have gone ahead. And instead of using a mechanism like COVAX, they have more bilateral arrangements with these manufacturers or direct arrangements with these manufacturers. And in a lot of cases, they have paid upfront for the doses. So even though the vaccine wasn't available, they had given to these companies monies to do their research and monies to ensure that they can manufacture and so forth. And in lieu of getting that money up front, these companies have agreed to release doses to those countries. So we are going to secure our vaccines through COVAX, and as we have spoken about this before, COVAX is going to ensure that countries get about 20 vaccines or doses for about 20% of its population in 2021.
Okay. As we're on vaccine, I know that today Pfizer goes before the US FDA, so that in itself would be good news.
Yeah, so Pfizer had applied to the FDA, and today they're going through what is called emergency use authorization hearing. And so the people, as a section of the FDA, would be talking to them and going through with them the data that they have submitted to check on the efficacy of the vaccine and so forth. Once that process is completed, the idea is that an emergency use authorization would be issued, and therefore they can start the immunization of persons. My understanding is that Pfizer has already moved a lot of those vaccines to distribution points, and in the US, people are, poised to start rolling out of that vaccine. We have seen that this vaccine has already been used in the UK, and so far it has been working quite well. There have been, I think, 2 cases so far where persons who had severe allergies had some form of reaction. Nothing, but the UK authorities have issued a warning that persons with these types of allergies should avoid, as of now, to get those vaccines. So the vaccine has started rolling out, and we'll see what happens after today in the US. So,
I know that in our own rollout program that there would be an education aspect, because Guyanese as well are concerned about these very allergies. They're looking at the international reports as well.
Well, we have through COVAX is working with a portfolio of vaccines, different types of vaccines. However, the aim is to achieve the same purpose, and that is for the person to develop immunity. But there are different types of vaccines that are going to become available on the market. Some are the traditional ways in which you make vaccines, and others are newer ways, like the ones from Pfizer and Moderna are totally new ways of making vaccines. So within the portfolio of COVAX, they are currently finalizing that portfolio. And therefore, when we get vaccines, it can be a mixture of vaccines. Some might be, different types of vaccines. So we'll await and see what the final portfolio would look like, and then we'll be able to run a proper education program with our population.
Okay, Minister. I want to take you to a topic that we covered numerous times, face mask. But in this particular instance, I wanted to talk about younger children wearing face masks. What is the protocol for that?
So the WHO has guidelines on this, and basically for a child up to 5 years of age, they have not advised that the child wear a mask. And the reason being is that children of that age, they don't understand why they have to do this, and they would be pulling and tugging and maybe not wearing it properly and so forth. So that's the main reason why it's not advised. Between 6 and 11 years of age, you will have to assess on the risk for this child. If this child has to go into maybe a high-risk COVID environment or something, you would want the child to wear a mask. But you can examine that on a case-by-case basis. At least that's what the WHO is advising. But any person, let's say from 12 to 16, the guidelines are similar to those of adults. So basically, you wear a mask in public and make sure that you cover your nose and mouth. So it's basically similar. So masking, if we simplify the guidelines, anybody above 12 years of age, you should be wearing your mask. Between 11 and 6, it's kind of optional depending on the risk. And below 5, if the child understands the reason and would tolerate the mask, then keep it on. But if not, the child can be exempted. But not that the child would not get the infection. It's just that, behavior of children of that age, that is why the recommendation was made.
Okay. Let's talk about the update, in the regional updates that we usually do. We read in Warapoka that there were some concerns there because somebody traveling out of the community tested positive. Have you had any talks or so with them?
But I'm not sure what's the nature of the concern, but we can have spikes in areas and then we contain it, and then, you can have other persons getting sick. So it's a constant thing where we have to do surveillance, we have to do testing, we have to do monitoring. No community is exempted. So we'll have to continue doing what we're doing, and that's what the medical teams have been doing in all the areas. So we'll continue to do our monitoring, and if we find cases, we are going to continue to test and treat as the case might be. We will now be able to detect cases faster because of our antigen testing, and we have completed those set of training, and we are deploying those test kits across the country. So the RHOs, the medical doctors who are going to be in these outlying regions are going to be able to diagnose COVID-19 faster within a 20-30 minutes period. So this is going to be very helpful in how we identify people and how we treat people.
All right. In the case of Warapoka, unlike all communities, the information has to get back down to the ministry, to the task force, because I believe that they're also asking for more tests to be done. So once one is recognized, once the information filters down, then the team is sent here, and then you would have indicated earlier that there is something set up where in these regions they already have a mechanism in place.
Yes, so the simple answer, if we find somebody who is positive, then we will talk to that person to deduce from that person who were their contacts over a specific period of time. And once we identify those persons who they would have been in contact with, then we then go and look for those persons, talk to them, try to get to see how much they've been exposed, and then ask them to go into quarantine. If they've been exposed for more than 5 days, then we can do a test, because we want to make sure that if you go too early, you mightn't find anything, but within a 5-day period, generally we tend, if somebody has been exposed and they actually got COVID, we generally see that the test would come back positive. So we can quarantine those contacts that the person had, and then later on make sure that we test them to see whether or not they're positive. So this has been what we've been doing, and it has worked for us, and that's what we're going to continue to do.
Okay. What about the other communities that you've been monitoring more recently?
Well, I think our challenge really has been with Bartica now. We have seen the cases, there are about 80, and we're going to continue to monitor that. In about maybe another week or so, many of the cases that we've been monitoring in Bartica we'll be able to discharge, because, as I said before, most of these cases are asymptomatic. So after a 10-day period, we would be able to discharge them. So you'll see that number start coming down. But again, because Bartica has been used as a transit point for persons coming out from the mining districts, we want to ensure that if people are coming from an area, maybe let's assume that they were more exposed to COVID in those areas, and then they're coming through Bartica, the chances are they can infect people as they pass through. So we have put some mechanisms in place where in those particular mining districts that we think might be high risk, that we have medical teams that would be there to do some checks, and once we complete those checks, those who are negative would be allowed to travel. So we are taking some proactive measures in terms of trying to reduce spread.
Okay. Just my final question before we go. What is being done in terms of monitoring? I know we're in the Christmas season already and you have people traversing everywhere. So is there a particular plan in place for that?
Well, what we should be doing is that everybody needs to take on some personal responsibility here, because we know that COVID is here. COVID hasn't disappeared. We haven't been able to get a vaccine as yet, so we haven't immunized anybody as yet. And therefore, those precautions that we were talking about since March, people still have to abide by them. And this process can be helped if we have other partners and collaborators. So the businesses where people are going to come and shop, you have to take the precautions. You have to put the measures in place so as to ensure that people who are coming to shop at your facility can do so in a safe environment. I know around this holiday season, people tend to crowd up in shops. If you really don't have to go out there, don't go. A lot of people go out and do window shopping. But when you go and do window shopping, you're exposing yourself because you don't know who's around you. So I think if people can modify their behaviors a little bit during this season, a break from the traditional way of how we have been doing things, I think that's going to help us. If we don't take on this personal responsibility, then I'm afraid what we'll be seeing is coming out of this Christmas season, we'll see a spike in cases. Now, we can all avoid this if we all take precautions. So now is not the time when we should just, discard the mask, go have a jolly good time, go to get some drinks or go into a restaurant. This is not the period, right? You still have to be vigilant. You still have to take these measures seriously, and you have to practice the measures, not just knowing the measures. You have to practice them. And if you do so, well, then all of us are going to be safe.
All right. Minister Anthony, thank you so much for speaking with us yet again.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and of course, the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.